Started as an intern. Started working for Edward M. Kennedy, the person, though, the United States Senator, where Senator Mark and I first met when he was in the House. And an internship, as you all know, anyone who's had one or had an intern work for them, is an incredible experience for folks of all ages and a great opportunity to learn. So welcome. You're welcome to Kennedy Community Health anytime you want to come. I will do a very brief hello. My name is Steve Kerrigan. I'm the President and CEO here at Edward M. Kennedy Community Health Center. Before we go on with our program, which includes our board chair, I want to thank the Mass League of Community Health Centers, the best primary care association in the entire country, who has their staff but led by their incredible leader, Michael Curry, here. So thank you, Michael, very much for being here. I say to my staff all the time when we go to national conferences, it's really good for folks from Massachusetts to go because we see very clearly how awesome Massachusetts is compared to everybody else. So thank you, Michael, for your leadership. Without further ado, I want to welcome our board chair at Community Health Centers. Those of you who don't know, our boards are required by federal law to be 51% consumer-based or to have a connection to the community. We are lucky enough that Ivy Nguyen, who lives and breathes Worcester, she grew up in the Valley across the way, received her care here at Kennedy Community Health, left to go to law school, but then brought her talents back here to Worcester and is a partner at Bottage & Dewey and a fantastic leader for our health center as our board chair. So without further ado, Ivy, thank you.
Stole my thunder there. Good morning, everyone. Thank you all for being here. As Steve said, I'm Ivy Nguyen, and I am chair of the board of Kennedy Community Health Center. I've been chair for, I don't know, a couple years, but I sat on the board, and as a lifelong Worcester resident, I believe in access to quality health care, and I think that it changes people's lives, and I believe myself to be a person whose life was changed in the positive to get baseline great health care so I could sort of move on to better the situation of my family and come back to Worcester, right? So I think that the health center is doing that for many thousands of people and has done that for 50 years. So I thank you all for supporting community health centers, and I'm really, really excited to see where our health center is going to go in the next 2, 3, 4, 5, 50 years. With that, do I?
Sure.
Chief Medical Officer is Dr. Pablo Hernandez.
All right, so good morning, everyone. My name is Dr. Pablo Hernandez. I'm the Chief Medical Officer for Kennedy Community Health. And along with my colleagues here at Kennedy, I believe in access to quality health care in culturally and linguistically appropriate manner is crucial to the success of our patients and our community. As the Chief Medical Officer, I have the pleasure of overseeing the work of our providers and staff at all of our four health centers, as well as the school-based health center that we have locations, and the dedication and compassion our staff have for the health and well-being of our patients is what really allows the health center to succeed in fulfilling our mission to provide health care and to help people live healthier lives. And that's what I keep repeating all the time to all of our providers, and that's what everybody here does and is learning to do. So I look forward to continued success in the health center as we prepare for the opening of our newest facility in Milford, and we will continue to provide care to all who seek it, and I'm grateful to join you this morning. Thank you.
And now me again. Very briefly, for those of you who don't know, and I said this to the senator when he arrived, we were founded 51 years ago in August across the street by 7 brave moms who were sick and tired of sending their kids to the emergency room for primary care. If it weren't for those women who said enough is enough for health care for their kids and their families, they opened one room in one building across the street, hired a nurse practitioner, and from that one room in August of 1972 to today, we are in 11 sites across central and metro west Massachusetts. We employ 470 people across the region. We see almost 32,000 patients a year. We have 6 school-based health centers providing dental, behavioral health, primary care, gender-affirming care, nutritional, on and on and on. But it all stems, and I think of those 7 brave mothers every day, it stems from their courage to say enough and to fight hard for their families. That is something that our supporters, our staff, and our team here has been incredible at bringing to life their vision and their their hopes and dreams for their families and for families they would never meet. But we couldn't do it without the strong support of folks like our mayor in the city of Worcester, Joe Petty, who has joined us here today, and our incredible delegation in Washington and on Beacon Hill. And Ed Markey, who has joined us today, has been fighting hard, particularly in his role now on the Health, Education, Labor, and Pensions Committee in the United States Senate, to make sure the community health centers get the funding they need to ensure that we are here past September 30th when that fiscal cliff comes to provide that care. And it cannot go overstated how important it is for folks like Senator Markey to come here in our community, see the great work that we do, and to bring that knowledge back to Washington and fight hard for us as he does each and every day. And so it's my pleasure to welcome our friend, Senator Edward Markey.
Thank you, Steve, and thank you for all the great work that you have been doing. Your vision for what is possible actually has an infinity sign next to it in terms of all of the services that you can envision being provided and improved as the years go by. So thank you, Steve, for creating a national model here in Worcester. And thank you, Doctor, for all of the great work that you do here every single day with the incredible staff that you have here in order to serve the community of Worcester and beyond. And Ivy, thank you for coming home. Thank you for being, a leader here with the personal experience you have had just from living this whole story right from the beginning. And Mayor Joe Petty, thank you so much for joining us and for the leadership which Worcester is providing as a city. Just puts out a welcome map to refugees. In Kabul, Worcester is on the kitchen table because so many family members came here and so many aspire to come here. Ukraine, but Haiti, Ghana, country after country. This is a city that is almost a.
Yes, they were working.
What did it say? Portuguese interpreter. So, just one of the 80 languages spoken here. There's 79 more devices that are going to go off, including trying to understand someone from Malden. There's a translator for that as well. So, thank you, and to Michael Curry, who is in charge of all of our community health centers in the state of Massachusetts, and it got invented here, and it continues to just improve and improve, and Michael is a national model for who he is. We're only 2% of America, but we're not just the Bay State, we're the brain state. So we keep trying to figuring all of this out. Your expanded dental, expanded behavioral health, expanded gender-affirming care, expanding is just a reflection of the national leadership which Worcester is showing in Massachusetts in general. So thank you so much for everything that you are doing. And, I'm married to a woman who joined the National Public Health Service 40 years ago. She joined as a public health service doctor. And on our first date 38 years ago, she said to me, prevention is preferable to cure. And that's what happens here every day. People can come here from the community in order to get the preventative care which they need in order to avoid an ever worsening condition for their family member or for themselves. And the welcome mat is out here in the same way it is for the entire city of Worcester every single day, no matter who you are, no matter what your race, no matter what the country of origin, no matter what language that you speak. They have a way here of making sure that you feel welcome, and that's just so important. And the headline today is this incredible heat dome over the Midwest with the winds blowing east now, and right now cities in the Midwest are the single most polluted in the world. They're in the upper 1/2 of 1 percentile. And a lot of that is just climate change. And then all of the diseases that are attendant to climate change, increased asthmas, increased disease across the board, particulate matter. So it's code red and code purple all across the Midwest right now, and the headlines right now in the New York Times and the Boston Globe it's starting to blow east again. So we know that in addition to all of these other conditions, that climate change is definitely going to increase the risk for families here in Massachusetts, but all across the United States as well. In the last 9 years, they've been the warmest yet recorded in the history of our planet. And 90% of American counties were hit by climate disasters between 2011 and 2021, disasters that cost more than $1.2 trillion and took thousands of lives. The planet has a fever. There are no emergency rooms for planets. So we have to engage in preventative care to make sure that we get ready for these catastrophes as they're beginning to unfold. The National Weather Service is already predicting a hotter than normal summer in Massachusetts this year. Here in Worcester, that could mean more than 320 hospital visits due to extreme heat just this summer because of the enhanced heat that people are expecting. And we know that heat isn't felt equally. Urban heat islands mean folks in downtown Worcester see temperatures up to 10 degrees warmer than the residents of Grafton Hill. And a lot of that is just geography. In the same way that we know the people who live in the inner city have life expectancies that are 20 years shorter than those that live just in the suburbs a mile away. And so we know all of these conditions are there, and we have to be realistic about it, and we have to make sure that we deal with it. However, an estimated 100 million Americans lack access to primary care in the United States as we gather here today. 90% of Americans live in counties that have been hit with a climate disaster. In the last decade, 40% live in counties that faced a climate disaster in 2021 alone, and more than 600 hospitals face the risk of closure across the country. Inequities in healthcare, access among communities at the front lines of our nation's dual climate and public health crises have worsened in recent years, primarily impacting frontline communities, rural communities, black, brown, and immigrant communities, all disproportionately impacted by this change in our climate. At the same time, the healthcare sector currently accounts for 8.5% of greenhouse gas emissions, compounding these crises and undermining health outcomes and our nation's climate goals. Frontline communities are suffering the impacts of climate change, and the pandemic has pushed our healthcare system to the brink. And our nation's children today will face 3 times as many climate disasters as their grandparents did, including wildfires, superstorms, flooding, tornadoes, drought, and that means less time playing outdoors, more asthma attacks, and for their developing systems and organs, dirtier air in their lungs and worsening allergies. People are dying today from climate change. And yet, in the midst of compounding crises, havens like the Edward M. Kennedy Community Health Center continue to do more with less. Time and time again, we ask our healthcare heroes to show up while the rest of the world shuts down. Without fail, you deliver here at the Community Health Center in Worcester, Massachusetts. And it's time for the rest of us to deliver for you. It's time for us in Congress to guarantee the protections, the resources, and the political will to protect our communities, our workers, and our planet. Personal Protection Agreement, PPE, is more than just masks and respirators and gloves. PPE is climate-smart policy. It's resilient funding, and it's clean energy solutions. We can ensure people can get the care they need and spare communities from the devastation of stronger storms, hotter heat waves, and worsening wildfires. The prescription for what ails us is clear. We need a whole of government and whole of health approach to the intersecting climate and health crises. And that's why I am, as the chair of the climate subcommittee and also the chair of the health subcommittee in the United States Senate, focusing on these issues. I wrote and released the Green New Deal for Health to tackle the converging climate and public health crisis. It is a national treatment plan to build a healthcare system that delivers the care that people deserve in a dangerous climate-changing world. When I won my congressional seat 47 years ago, Tip O'Neill, who was the Speaker of the House, asked me which committee I wanted to serve on. And I said I wanted to be on the Health Committee. And for 36 and a half years, I served on the Health Committee in the House of Representatives in Washington. And now I'm the chair of the Health Subcommittee in the United States Senate. So this is a focus that I've had right from the very beginning of my career, and that's why I have written this national treatment plan, along with Congressman Ro Khanna of California and Congresswoman Alexandria Ocasio-Cortez from New York City. It's to focus on these issues, and it's to make sure that we do it with equity, and we do it with a focus on who's going to be harmed the most. So the Green New Deal for Health embeds health, labor, and climate justice in the systems of care. It would authorize $130 billion to support community health centers and to boost climate mitigation efforts while expanding affordable, accessible care. The Green New Deal for Health boldly reimagines a healthcare system that is prepared and empowered to protect the health and the well-being of our workers, our communities, and our planet. And we can do this. So to foster healthcare access, the Green New Deal for Health would invest $130 billion over 5 years in community health centers so that everyone has access to high-quality care right in their communities. And that's a dramatic increase over the funding from a national level that we have now going down into the communities. We can invest $100 billion to build green and resilient medical facilities to ensure people can access care before, during, and after a storm or other climate disaster. The Green New Deal for Health would invest $9 billion in the backbone of our healthcare system, the workers who make high-quality health care possible by directing federal dollars towards climate and health education, building a robust community health workforce, prioritizing grants to facilities that collectively bargain with their workers, and providing hazard pay to the workers who show up to care for us during and after a crisis. We saw that during the pandemic. The healthcare workers showed up every day for us, even as they were jeopardizing their health and their family's health. And so we have to recognize the need to have hazard pay for those who put themselves in the line of danger that ordinary people can just stay home and Zoom towards their job. Healthcare workers cannot do that. The only temperatures our nurses, physician assistants, and doctors should have to deal with are inside the healthcare facility for their patients, not outside in the heat of warming communities. The Green New Deal for Health ensures that workers have a seat at the bargaining table and the right to negotiate good working conditions. We can build a healthcare system that doesn't just heal patients, but heals communities, addressing climate resiliency and the socio-cultural determinants of health. All it takes is political will. As Pope Francis reminded us in Laudato Si, his encyclical about climate change, about the planet. Laudato Si, maybe that's the 81st language, Latin. It's a dead language, but in the Vatican it still lives with the Pope. Laudato Si means in praise of everything, the whole planet, its health, and the health of everyone who is in it. That's what he tried to focus upon. Everything is connected on our planet Earth. We share a common home. Concern for the environment thus needs to be joined in a sincere love for our fellow human beings and an unwavering commitment to resolving the problems of society. The Green New Deal for Health brings together the principles of the Green New Deal: good paying jobs, justice for all, and a livable future, to create an effective and equitable healthcare system that people deserve. A healthcare system where everyone doesn't just survive, but they thrive. For climate justice, for worker justice, for healthcare justice, I know that together that we can enact a Green New Deal for health that ensures a healthier, more prosperous, cleaner, more peaceful future for everyone. And here at the Kennedy Community Health Center, these workers are entrusted with the most outrageous dreams that the parents have for their children in the United States. And those dreams can come true, as they have for so many others. My grandfather came here and grandmother, and their grandson is a United States Senator. And those are the same outrageous dreams that people have as they come here from countries all over the world to Worcester. And here they are able to receive, as their right, the health care they need to provide for them and to unleash in them all of the God-given potential which they've been given. So we thank you all so much for everything you're doing. Steve, Doctor, all of the workers here for everything that you do every single day. And if there are any questions, we'd love to take them.
Sean Grady from Spectrum News.
Hi, Sean.
What is the status of the Green New Deal health deal?
Well, Senator Sanders is the chairman of the full committee. I'm the chairman of the subcommittee. So we've been negotiating intensively with Republicans in the Senate, trying to ensure that we get as much as we can get this year, and then to continue to build upon it. And we've had productive discussions in many of the areas and not so productive in others. But we are committed, Senator Sanders and I, to helping to lift the gaze of the Senate to the constellation of possibilities in providing additional health care services for everyone in our country.
Was there bipartisan input into it?
Yes, we've been meeting for 3 months now, 4 Democrats and 4 Republicans, towards the goal of finding a new pathway for our public health system in the United States, and that includes more doctors and nurses in our society. Right now, 40% of the patients in the country are black, brown, and immigrant, but only 5% of our medical personnel are black or brown. So we have to alter that. We have to provide a funding stream that makes it easier for those from black and brown communities to be able to gain access to the medical education so they can come back in order to serve those from whom they actually came.
Is there a timeline when it would be sent over to the House, or is the House negotiating on it as well?
Well, we're trying first to finish it in the Senate, and we're doing it as rapidly as possible. And I think that, without question, over the next several months, that would be our goal, to produce a new framework for the community health system in our country.
I just have a couple other questions that aren't related
Sure.
to the Green New Deal. One does have to do with climate change. MIT and Wentworth recently had a study that said that if net zero codes, building